thank you for joining us for this Scaling Up Community of Practice webinar. We have a great program today. This is the third, I believe, in a series of webinars that we are hosting on the topic of mainstreaming. This year, the Scaling Up Community of Practice has began an initiative on how organizations are mainstreaming scaling into their activities. By mainstreaming, we mean integrating them into their operations. So unlike many of our webinars, which focus on the topic of particular cases of scaling up, where an organization has taken an innovation, a project, or a program to scale, or a program has gone to scale, this program focuses on the way that an organization changes the way it does business, so scaling becomes integral or a main part of their activities. So though our guests will be talking a little bit about some of the scaling things they've done, their primary emphasis will be on how they've integrated into their activities and organization as a whole. We're very fortunate today to have HarvestPlus with us. I'll let them talk about what HarvestPlus is, but it's basically a research organization, research, innovation, and scaling organization that has been working on biofortified foods and innovations for quite a number of years. And we're delighted to have with us Jenny Walton and Katrina Deal. The two of them will present the HarvestPlus case for about 25 minutes. And then we're fortunate enough to have with us three speakers, commentators who have worked with HarvestPlus. I'll let them introduce themselves later, but basically representing the partners of HarvestPlus. We will, after they speak and talk about their experience, have a fair bit of time for question and answers. And finally, we'll conclude today. This is an hour and a quarter presentation, the webinar this morning, with some comments on the overall lessons learned from Julie Howard, who is now a senior fellow at the Center for Strategic and International Studies. So without further ado, Jenny from HarvestPlus, Jenny Walton, we're delighted to have you. Please go ahead.
Thank you, Richard. I can't see the slides. There we go. So thanks, Richard, and thanks to the Community of Practice for the opportunity to talk about our case today. Katerina and I will talk for about 25 minutes, and we are very much today focusing on scale and reach, not so much on impact. So impact, obviously, a very important critical part of the puzzle here, but we are deliberately talking about scale and reach. So I want to start with the driving force behind our program, and that is micronutrient deficiency, so hidden hunger. And 1 in 2 children on a global scale suffer from a micronutrient deficiency of some sort, and as many as 9 in 10 women in sub-Saharan Africa and South Asia will be suffering with at least 1 micronutrient deficiency. And it's not just a case of not enough food. Very often there's the case of too much food, and you get the double burden of both obesity and micronutrient deficiency happening simultaneously. In India, we are now at the 100 million mark with people suffering with diabetes, and non-communicable diseases will also benefit from increased, especially zinc, in the diet. So there are complementary approaches to tackling micronutrient deficiencies, all of which important, and all of which have an important role in tackling those micronutrient deficiencies. And to say that the situation is getting worse, and there are many partners and agencies and working together globally to tackle micronutrient malnutrition, but we are facing headwinds such as COVID, natural disaster, climate change and war that's actually making the figures worse. And as humans, we are eating less, we're consuming less calories to combat obesity. So it's never been as important to have every single calorie containing as many micronutrients as possible. So those complementary approaches to tackling micronutrient deficiency, at the top there you have supplementation, very effective, especially with acute malnutrition, but costly and quite hard to implement sometimes. Post-harvest fortification, which is the addition of vitamins and minerals to foods after fortification. Again, very effective and cost effective, but not always well scaled and rolled out. Only 1% of rice globally is fortified. Then dietary diversity, a basic human right. We all should have the option and access to as many different foods as fruit, vegetables, meat, fish and eggs. We should all have that option. But even when people do have that option, consumers are not eating the ideal diet. Which leads us to nutrient enrichment of staple foods. So the common thread as humans is the staple foods that we eat on a daily basis, whether it's pizza in Italy, whether it's beans in Rwanda, or whether it's bread in the UK. We're all eating these staple foods. So it's the most cost-effective and equitable solution to reach as many people as possible by increasing that micronutrient content of the foods that we're all consuming. So biofortification of staple foods, so increasing the nutrient content of foods through breeding, which is what we're focusing on today, but there are other ways to biofortify. The idea actually came from an economist. So this was an economist thinking sort of mathematically and logically, how do you reach as many people as possible? And if we're all eating these staple foods, why don't we just make these staple foods better? That's the most equitable way to the most people. And 20 years ago, when the HarvestPlus program came about, there wasn't this discussion about food system transformation. But that's what Howdy had in his mind. And he was really visionary in his thinking then about how you actually transform a food system, especially the foundation of the food system through biofortification. We've all been in those meetings where you have an artist or an illustrator like jotting down and drawing pictures of what's going on in the meeting. And they kind of go by the by, but that picture there that you see then was from a meeting at HarvestPlus 15 years ago, and we are still guided by that drawing now. And you see there at the very end, our goal is to reach 1 billion people. And we started at the goal. So in many cases where you have a product and you're trying to get it to people, we had a number of people and work backwards. How do you reach them? And then how you actually do that, these are the actual vehicles to get the more micronutrients into the food system, into everybody. Everybody on this call, everybody on the planet will be eating one of these foods on a daily basis in large quantities. So increasing the micronutrient content of those through breeding and agronomic biofortification is how we want to improve the nutrition of these foods through the major nutrients of concern being iron, zinc, and zinc. So you have the vision of 1 billion. You have the vehicles that are going to get there, but then how do you actually get these seeds, grains, and foods to farmers, to businesses, and importantly to consumers? So we have through 15 years of work, through 20 years of the HarvestPlus program, and then 15 years of actual delivery, we have honed in what we call our delivery model, and it is a 10-step process through the biofortified value chain with a set of activities at each stage. And you hear about supply and demand pull and those kind of things. I think quite often you can think that it's just supply at step 1 and demand at step 10, but it's not. there's supply and demand going on at each of these steps in the value chain, which we have to manage, support and grow that supply and demand. Then we have our scaling strategy, which is the global view and of how you take that delivery model into different countries, into different crops, to different markets, and how you go through a process of bringing the product to market, to taking it to scale. HarvestPlus, 20 years old. If you were with us 2 years ago as an employee, you wouldn't recognise us now. The pace of change of how we work is really rapid. And we started off with the crop breeding, with the proof of concept, with the nutrition intervention studies, the policy, the advocacy. And that was in the first phase of HarvestPlus, and now moving into scale and commercialization. But that initial work still goes on. It's not just a case of job done, move on to commercialization. It's a cyclical process. We have to keep working on the advocacy, the proof of concept, making sure that what we're actually taking to consumers has an impact on their life and health. And Katerina will talk more into that cyclical process.
Thank you. So quite contrary to the snake image that you've seen just now, the delivery model that we follow is not linear, it's rather a spiral. And the spiral, even if it's more of a wheel here because PowerPoint is flat, this spiral can be used to understand the complete cycle of biofortification, but we can also apply it to each individual segment of the value chain that Jenny has just shown. So at the outset, we have the described solution. We have a biofortified staple crop that is ideally available, affordable and accessible to our target groups and will improve the global staple food system. This cycle basically starts off after the proof of concept that was also just mentioned, and the proof of concept can be equaled with the official release of a biofortified product. So the official release is the final stage of identifying target crops and target populations, setting nutrient target levels for those crops, and doing the crop improvement research and probably also nutritional efficacy studies. So starting with the introduction phase of every intervention that we do, this will contain an assessment of the infrastructure, of the gaps that appear in the value chain, of looking at market potentials and to develop strategies to improve this delivery. Then when we go to the scaling phase, the activities can basically be summarized as technical assistance, which, for example, would be knowledge sharing from our R&D, the product development support, for example, working towards certification of seeds or food branding, and lastly, the market development support, where we do awareness raising, marketing and demonstrations. So at the beginning of the scaling phase, the activities will be more mission-driven, so-called market push, working the factors that push into the market. And over time, the activities will transform into more and more market and need-driven, and working the so-called market pull factors. In the anchoring phase, then finally, the activities have the objective to maintain robust supply chains beyond the funding phases of individual projects and interventions in order to reach farmer households, increase the resilience, create value for our target groups, the farmers, for example, or the processors, in order to reach our final expectation of the health benefit that we are working towards. And also, as we go through this cycle for every single intervention, the learnings feedback to the previous segments of the value chain of the delivery model. So we can improve backwards the food system, the seed system, and all the way back to R&D. So what you see is very much a trial and learn with a continuous calibration of the delivery model, as it has to maintain pace also with the environment of the respective seed or food system, also with upcoming global changes, of course, weather changes, changes in food and consumer preferences. So while we go through this continuous calibration, we also have a continuous development of products and delivery strategies over time. So if you look at, for example, at businesses that have been successful for many decades, like Kellogg's, Cornflakes, or the iPhone, they continuously adapt to a changing market and adapt their products. So similarly to these companies, a zinc wheat product in Pakistan needs to adapt to the market environment, and it can't afford to be a BlackBerry that goes out of the market. It has to be adaptable like the iPhone. Next slide, please. So in our monitoring and evaluation, we track a number of indicators, but today, because we are talking about the success of the delivery model itself, I'll just focus on consumer reach and on the market share as two indicators. The consumer reach on the left shows the number of people in farming households with access to biofortified crops. And there we want to, we in 2023 are just at about 100 million households that consume biofortified products. This is in fact a conservative calculation, as for every 100 people that eat on farm, we're talking mostly about farm households here, we estimate that another 15 people purchase biofortified products on the open market. On the right-hand side, you see the market share, which describes the percentage of biofortified products in the market as compared to non-biofortified. And there are a couple of examples for grain, for seed, for wheat or bean markets in different countries. In terms of scaling, it's probably relevant to mention here that HarvestPlus has worked overall on just about 400 varieties of staple crops, and several issues in regard to scaling follow out of this. So, for example, in each country, the products will differ, for example, in multiplication rates or consumer usage. We observe that consumers in drought-prone areas require a different variety to do a successful scaling in comparison to wetter areas with more water. Or consumers in northern Nigeria prefer vitamin A cassava as a boiled product, and they will also prefer a different variety to consumers in southern Nigeria. So we have to adapt also to these consumer preferences. Another issue is that biofortification is not always visible. The benefit is not always visible in the product. So for beans, for example, the biofortified beans are almost indistinguishable from non-biofortified varieties. So the benefit cannot be easily shown when selling on the market. And other crops, like the vitamin A crops in maize and orange sweet potato, they vary in color, but may also be met with a consumer hesitancy regarding that. On top of all those difficulties, challenges, the difference of biofortification are not always reflected in the willingness to pay by consumers or in the market price. So while a higher market price would sometimes help us to drive adoption or even attract private investment, a lower market price can also help us to reach the more vulnerable households in their own consumption or via public procurement. So with a lot of variance in the product itself, as well as in the environment of the scaling system, there's definitely no one size fits all, although we can work on one delivery model that kind of combines all those scaling activities into one model. So next slide, please. Yeah, but the range of products that we have, and here you can see a range of products from the seed system, actually show that the delivery model has in fact proven successful over time and countries and crops. So the seed available, as it is the prerequisite for all further scaling activities, for the first as Jenny has mentioned, for the first probably 10 years, HarvestPlus has focused the activities very much on the seed and crop development, next to the country coordination, next to refining the delivery strategies and awareness raising to ensure that the biofortified crops eventually reach the food system, which you can see on this slide now. So over the last recent 10 years, we increasingly incorporated the food system in our activities, which, by doing this, we have observed that the offtake of food products has incentivized farmers to increase their quality, to increase also the quantity, to sometimes formalize their buyer-seller relationships, which helps us a lot, and also to cooperate in aggregation for trading and for sales. And on a side note, also, as we move from the seed system to the crop production to the food system, the number of women increases in the target groups that we cooperate with. So this brings me to the lessons learned, which would be on this next slide. HarvestPlus was set up not as a legal entity, but as a joint venture driven by two CG centers, the CGIAR and IFPRI. And HarvestPlus could operate all this time autonomously under a program umbrella while relying on the structure and the services of the institutes. Many donors over time also contributed to streamlining the activities that we did. And for example, in 2017, FCDO pushed us to formalize our learning journey, and we went through a process of looking at the costs and benefits of all the activities that we had conducted so far. So one key message here is that we need to balance our work between high impact activities versus cost effectiveness on the other side. So some activities may be very work intensive, but necessary to address disrupted agricultural infrastructure and value chains. And those work-intensive activities can, for example, be trainings on farm level or field days or demonstrations, but they will show us how to close some of the gaps that we face while scaling. So also, due to our structure as a research-hosted entity, we can't, for example, provide startup loans or equity investments to kick off a product in the market, but we have to use market incentives based on partnerships with producers, with processors, and we have to make full use of the enabling environment by the market or by regulations that exist in each location. But on the positive side, this has supported country programs to rather organically gravitate towards commercial value chains. So Nigeria, for example, was the first country to involve in the development of commercial food products, and a lot of countries have followed up since. So overall, it's a matter of consideration of how to balance social benefits and impact-oriented activities that match very well with public funding, with third-party donors and institutional support on one hand, and match this with or balance this with commercialization-oriented activities with private sector partners, private investment and market linkage on the other side. All the while considering, of course, the location, the socioeconomic environments when planning our activities and interventions. So speaking of the enabling environment, I think we currently observe that the global changes prove that our approach and our products are increasingly timely. This includes, for example, what I mentioned before, the changing dietary behaviors towards healthy foods, but also an overall requirement for improved seeds in many countries due to the changing climate and weather in many locations. And followed by disease patterns, by requirements to storage and to pest resilience that just require an overall seed improvement. And then we can also integrate the higher nutritious content in our priorities. And maybe just to add that with the COVID pandemic over the last years, we've also seen ruptures in traditional import-export relationships, and that currently incentivizes many governments that we work with to give more importance to the national agricultural production systems. For HarvestPlus itself, COVID has also had another positive side effect in that it has pushed us towards digitization, and we are currently working on many digital products in our interventions and with our partners. So let me stop here and hand back to Jenny for some high-level learnings and the wrap-up. Thank you.
Thank you. So I hope we've shown a bit of flavour to the delivery model, and testament to that delivery model is the results of where we are at today at 2030 of reaching that 100 million mark, and our aim, and the 1 billion is that guiding light to get there by 2030, and we're currently on schedule to do that. The delivery model that I talked about is can be applied to other products as well, and that methodology of taking something to market and taking it to consumers, importantly with successful products. So the seeds and the crops that are developed are competitive in the market, not just from a yield perspective, but also disease resistance. We've got to have good products, whether that's the seed, the grain, or the food. This movement of biofortification is going to be successful. So in terms of like the high level and the big picture learnings, and how we're going to take those learnings, successes and failures, and how we're going to learn from them to go forward to get to that 1 billion. I think, you know, the issue of R&D and scaling and delivery, it's not a linear process. This is cyclical. Without R&D in the seed system, we have the potential to go backwards. We have to continually invest in the R&D of seeds and foods. We're not just a sort of it's not just biofortification. You have to understand the entire ecosystem of the people that we want to work with and the consumers. They may not be focused on nutrition. That's not the #1 thing that farmers are thinking about, or consumers. So how do you find hooks that actually generate an interest in being part of this, and understanding what's going on in the users' lives? The issue of gender is so important, and even though this is a biofortification program, gender is so interwoven into the work that we do. If we don't fix the gender issue in with our other partners, we're not going to fix the food system issue. And also, just talking in malnutrition in general, it's not competition between the other interventions, whether it's dietary diversity or fortification or supplementation. We work well with the other partners to integrate all of these into the food system. Briefly mentioned digitization. It is quadrupling our efforts, what we're able to do with digital in terms of marketing, business to business marketing, business to consumer marketing. And we've got to be modern and modernize our approach from that face-to-face farmer training that we used to do over to digital reach, digital communications, digital marketplaces. It's going to take us to that 1 billion. We have to have a private sector mindset to be able to do this. So this is the transition from the development of a global public good to the private sector. So we're the intermediary between private sector and these public goods. So we have to be efficient, goal-orientated, profit-orientated, which sometimes can feel a bit strange to many people, and sometimes the food businesses are seen as, you know, part of the problem of malnutrition in the world today. But if we don't work with them, they're not going to be part of the solution. So having that private sector mindset and of efficiency and and reach at the very heart of what we do. And at the same time, not forgetting our primary beneficiaries, so the world's most vulnerable, who are affected on a daily basis by their health because of malnutrition. I hope in what we've said today, it's not job done, far from it. We've built up this momentum. We've had that slow stage in the beginning where our initial donors were really patient with us, where we were almost like flatlining in terms of reach, but you see it's taking off. It's because we've got that early seed production, and it's just exponential now in terms of affecting seed markets. It's the mega variety in Pakistan. It really is. It is working on a country crop basis. We're in different places in different countries with different crops, but it's working. The difference, I've said at the outset, we've not talked about impact, and there's that difference in talking about scale versus impact. It's by no means not we've forgotten about it. It's just not what we've focused on today. It's great reaching 1 billion, but what if the products that we develop and the products that we take to consumers have to have an impact on their health. But you can say that about all of the other interventions in micronutrient malnutrition. Time will tell. You can do the individual studies to show the benefit in controlled populations, but we're not going to see the benefit of these interventions for years to come in terms of population statistics on malnutrition and health. But we've got to keep up the effort and keep up the momentum, and ensure that we learn from the lessons we have in the programme over the last 20 years. So that's over in our presentation. The links are there or the QR codes are there to the specific point, and that's the QR code to the impact research. And now we're going to hear from some people we work with. Thank you.
Thank you so much, Jenny and Katrina. Indeed, to move right along, we are fortunate to have with us 3 partners that have worked with HarvestPlus for several years. And we're first going to hear from, I hope I get the pronunciation right, Atanuka from Kohl Foods. Atanuka, perhaps you could just say a word about Kohl Foods, and then about how you have worked with HarvestPlus and what your experience has been. As Jenny and Katrina just mentioned, this has been partnerships have been built in from the process, from the beginning. Could you talk about your role in the spiral? Are you involved in the seed design, or what has been the role of Kohl Foods in terms of this collective effort? So take it away.
All right, Al. Good afternoon from Nigeria. Thank you for the introduction. My name is Atanuke, and I'm speaking from Kohl Foods. So Kohl Foods is a food processing company in Nigeria. In fact, a pioneer biofortified food processor that is addressing malnutrition and eating hunger using biofortified stable crops. So what we actually do in Kohl Foods is not about the seed production, but we work with the biofortified crops to process into different value-added products to address the nutrition challenge in Nigeria and even Africa as a whole. So over the years, we've been able to process our products into different products, even that BOPs can even have access to nutrition that is being needed. So because we believe that biofortification is a sustainable and cost-effective way of addressing malnutrition, and that is why we actually work with HarvestPlus to deliver nutrition through food. And in rural area where we are at the moment, and also in Nigeria at the moment, we believe that if we really want to solve the issue of nutrition, we need to come from food, using food, because one of the things that is very important is people eat every day. And if you really want to solve this, it has to be through what they eat. Not everybody can afford tablets. Not everybody can afford pills. They're quite not really affordable, right? So we believe that if you come through food, through what they eat. So it's just about adding nutrition to what they're already eating, right? So that is how cattle food come in place. Like, okay, so we want to address nutrition through food and not just through tablets or pills. And because we believe that this malnutrition issue, it's prevalent in the areas, and that is why BOP, the people at the bottom of the pyramid, is really one of our target audience, right? And these are some of the products that we've been able to develop in cattle food. So we have the IFPRI, we have the custard. The custard is custard, a porridge-like, which is the first cassava-based custard that is being commercialized in Africa, because we really want to reach everyone, right? So if children are taking custard, if children are taking other cereal, they should be able to also take biofortified products that can deliver more nutrition than every other one. So that is why we're able to come up with custard, which is a porridge like that is suitable for children from 6 months of age, even to adulthood. We also have snacks. We also have snacks for these children that is sugar-free, very nutritious, that they can also snack on, because nutrition can be addressed in children, especially through snacks, because children eat a lot of snacks through sugar and all that. Now that's why we have snacks called Cattle Bite, which is very sugar-free and more nutritious. So we have other products like our IFPRI+, Fufu Plus. Now we added plus to those products because of the biofortification that is being biofortified products that is being involved in the processing of that product. So that's why we added the plus, because the plus is an added value to the product. And throughout our years of working with HarvestPlus, one of the things that HarvestPlus have been able to do for us as a private sector is technical training and also in product development, right? So when it comes to product development, we as much as we work on developing more products, one thing is very important to us, that we take it back to HarvestPlus and work along with HarvestPlus nutritionists and see how we could increase the nutrients of those food and see how the food can be commercialized, and see how the food can deliver the nutrient we said is going to deliver. So HarvestPlus have really been working with us in the product development a lot and capacity building, technical capacity. So it's those are the two major areas where HarvestPlus have really been of a good benefit to us. And so through biofortification, we've also been able to also train other women and youths to deliver nutrition through training them on food processing. So we also get ourselves involved in training other women and training other youths in food processing using biofortified crops. That's the vitamin A cassava, the orange flesh sweet potato, and the vitamin A maize. We work with 3 of them because they are biofortified, and we train the youths along the value chain. We train them in processing, we train them in marketing, we train them in packaging, and there's all these trainings also being supported by HarvestPlus, because it's the mandate of HarvestPlus is to also help to deliver nutrition, right? So they also get involved in trainings whenever we have trainings to train women and youths to deliver nutrition. So because we believe that there are a lot of work, there are a lot of employment opportunities along the value chain of biofortification. So, and that is why we committed ourselves to train women and youth in nutrition. Another thing we also do is also work with farming households, because we believe that to achieve nutrition through biofortification, we need to work with the farming household, the farmers, because they are the ones cultivating these crops, right? So one of the things that we've been able to do is anytime we need to reach out to farmers, HarvestPlus help with seeds, and we also support us with seeds to reach out with this farmer. That's the vitamin A maize seeds or the stems to support this farming. So far, we've been able to support about 500 farmers to cultivate biofortified crops, and we have about 1,005 of them on our database that are still ready to take up these biofortified crops if support have been given to them. And we are supporting these farmers because we believe that nutrition starts from the home, and everything that farmers been cultivated, their family also eats from it. And that's why we also commit ourselves that, okay, so we need to also train farmers. We need to support them with input, especially the seeds, that's the cassava seeds and the maize seeds to cultivate. you can see the picture of one of the farmers holding that big tuber of cassava. That is one of the farmers' harvest. And so far, we also work with extension agents with these farmers so that they can deliver to standard, so that they can produce what is nutrition. And also, we work with the cassava breeding department of HarvestPlus, the people also on the farming side that help us to train these farmers. So HarvestPlus has also been a very good advantage to us as a private sector in also helping us to deliver trainings to these farmers and also with seeds to these farmers. And so far, we believe that more can still be done, right, with private sectors in biofortifications, because we have a lot of private companies that are ready to come into biofortification, but support also be needed by them, right? So I believe that if private sectors are being supported more, a lot of impact will be made, because so far we've been able to reach over 60,000 households with our biofortified food products. Yeah, so far we've been able to reach over 60,000 households with our biofortified food product, and this year we are targeting to reach over 100,000 households. So I think if more support as still be gotten from our investors, we can also do more. So thank you very much, and I think IFPRI, thank you very much for the opportunity.
Thank you very much for that. And moving right along, since we're running a little bit late, I'd next like to ask our next speaker to speak. That is Dr. Asrat Dibaba Tolosa from World Vision Canada. Could you talk particularly, Dr. Tolosa, about how your organization has partnered with and the role they played in HarvestPlus?
Thank you very much, Richard, and the COP for having me and invitation. My name is Asrat Dibaba Tolosa. I work for World Vision Canada as a chief of party for a new nutrition grant called Reacts In. Today I'll be sharing the experience of an implementing agency in the adoption and promotion of biofortification in the Global South. From 2016 to 2021, World Vision Canada, in collaboration with HarvestPlus and other international and local organizations, implemented a nutrition and livelihood program called Enhancing Nutrition Services to improve maternal and child health in Asia and Africa. This program implemented multi-sectoral interventions, including biofortification, supplementation, food fortification, sexual reproductive health, health system strengthening, and gender equality interventions. The biofortification adoption and promotion was done in collaboration with HarvestPlus, and we implemented biofortification in 3 countries. These are Bangladesh, Kenya, and Tanzania. In Bangladesh, we promoted zinc rice. In Kenya, we promoted orange flesh sweet potato and high iron beans. And in Tanzania, we promoted orange flesh sweet potato. You can find a detailed information about this program from the link provided in the slide. And just to share some of our results and impact, at least at intermediate outcome level. From 2016 to 2021, over 6 years of period, we trained a total of 70,000 farmers on biofortification promotion in those 3 countries. Actually, enriched was implemented also in Myanmar, the 4th country, but we couldn't do biofortification in Myanmar as there was no a biofortified crop released in Myanmar, but all the other interventions were also implemented in Myanmar. So during implementation, as Jenny earlier said, we started with demand creation. We sensitized the lead farmers and farmers in the communities on the importance of biofortified crops, especially the nutrition and economic values of biofortified crops. So for this, we used various print and non-print media for awareness creation, including printing and distribution of leaflets to schools and billboards, and then non-print media like songs and community dramas and field farmers' days and demonstrations. The other strategy we used is using the lead farmers model. For this, we identified lead farmers like those one shown in the slide. And then we trained these lead farmers on how to cultivate biofortified crops, including seed multiplication. In addition, the program provided biofortified crop seeds and planting materials like orange flesh potato vines to these lead farmers, and these lead farmers also were encouraged to share the knowledge and the skills with other farmers within their villages, and we call that one secondary diffusion. HarvestPlus provided the technical support alongside the Ministry of Agriculture staff in those implementing countries. They provided technical support, including training of trainers for the Ministry of Agriculture staff, as well as also World Vision staff, and also field monitoring and on-the-site supportive supervision. In terms of outcome, as Jenny said, maybe this session is not about impact, but at least I can share the impact of the enriched program at intermediate outcome level from one of our countries. According to our final evaluation, the percentage of children aged 6 to 24 months who consumed meals prepared of biofortified crops at least 3 times in the past 7 days increased from 6.5% at baseline to 23% at endline in Tanzania. And this was verified independently by our monitoring and evaluation partner, University of Toronto. But we didn't measure, we didn't use biochemical indicators like measuring the micronutrient status of the target population. Now, this enrich was funded by Global Affairs Canada, the government of Canada, and recently we received additional funding to extend this program to another 7 years from 2023 to 2030. And we will be implementing again in Bangladesh, Kenya, and Tanzania. The new country added is Somalia. Again, we don't have biofortified crops in Somalia, but we would love to promote also biofortification in Somalia. But in this second phase of program called Realizing Gender Equality, Attitudinal Change and Transformative Systems in Nutrition, we will be scaling up biofortification together with HarvestPlus in Bangladesh, Kenya, and Tanzania by promoting those crops, the zinc rice, OSP, high iron beans, and orange flesh sweet potato. So that's in brief my sharing, and I would be very happy to answer any question. Back to you, Richard.
Great, thank you so much, Dr. Tulosa. We also are delighted to have with us Lawrence Kent from the Bill and Melinda Gates Foundation that has been a major funder of this. And perhaps, Lawrence, you can talk about the role that as a donor you have played and what you also think, given that you fund a lot of activities in agriculture, not you personally, the Gates Foundation, what the lessons might be from HarvestPlus for some of the other agricultural research you support. Thank you for being with us. I don't know where you are, but if it's in Seattle, so early in the morning, so please, Lawrence.
Thanks, Richard. Yeah, I am in Seattle where the Gates Foundation is based, and you're right. We've been on this journey with HarvestPlus almost from the very beginning, about 20 years. The Gates Foundation has been one of the primary funders of HarvestPlus. Originally, I think we were funding over half of HarvestPlus activities, but as more and more donors have joined in on the funding, we've become a minority funder, but still a proud and strong supporter of the work of HarvestPlus, having invested over this 20 years over $136 million in the program. And as has been said earlier, in the early years, a lot of the focus was on research. This comes out of the International Food Policy Research Institute, the CGIAR. A lot of the focus was on research, and there were key questions about, is it possible really to breed crops with higher levels of micronutrients? And a lot of focus was on the breeding, and then a lot more focus was on the nutritional studies to determine whether the elevated levels of the micronutrients in the crops would be bioavailable, could actually improve the nutritional status and ultimately the health status of those who consume them. So in the early years, a lot of focus was a comfort zone for IFPRI and the CGIAR. But pretty soon into our engagement with the program, we started pushing for movement towards deployment and impact. Because while the evidence was mounting that levels of micronutrients could be increased in these crops and that their consumption could improve nutritional status, there wasn't much evidence about whether they could be deployed at scale. And so we pushed pretty hard for HarvestPlus to say, hey, you've got to start engaging with the seed industry and see if you can get them to produce and sell seeds of biofortified crops. And we pushed hard, probably about 5 years into our funding, to say, HarvestPlus, can you move into this space? And there was some reluctance at first on HarvestPlus side because of, again, from the research orientation, but eventually they boldly pushed into this place. And originally we just set a target. Can you get 100,000 farm households buying and growing biofortified crops? And that became the focus. Now, this is going back about 15 years ago. And pretty quickly, the team, by engaging with seed companies in targeted countries in Africa and Asia, they reached that target and then quickly started to exceed it, going up to from 100,000 to 500,000 to 1 million, etc., working really hard in terms of engaging with seed companies and NGOs to multiply and make the seeds available for farmers, and working with extension services to push for their uptake. And I think by about 2013, there's probably about, they're in that 10 million household, 10 million people range in terms of 10 million people around the globe buying and growing of biofortified foods. What was good, but at that point, we had a bit of a conversation saying, hey, we can't do this arithmetically. We need to find a way to do it exponentially. If we have to pay for all of the seed production, we have to pay for all the farmer training, we have to pay for all the outreach through HarvestPlus, we're not going to have enough money to reach the really big targets that are on the horizon, that 100 million or even 1 billion target. To reach those targets, we have to stop using HarvestPlus money and start finding a way how HarvestPlus can leverage other people's money to get the job done. And at that point, there was a pivot within HarvestPlus towards two new strategies. One of them they called mainstreaming, and the other one was called crowding in investment and dissemination partners. So in mainstreaming, there was kind of a realization that the CGIAR has breeding programs that have been operating for many years that will continue to operate for many years. The HarvestPlus doesn't need to have its own independent breeding programs funding the work to develop biofortified crops, but rather can it influence the CGIAR to try to include nutritional statuses in their integrated product profiles. So whenever improved beans are being developed for higher yield or disease resistance, can there also be a target for them to have elevated iron and zinc in them? Same with pearl millet and other crops. And so there was a push to say, hey, can we mainstream biofortification into all the CGIAR breeding programs? And therefore, HarvestPlus wouldn't need to pay for those breeding programs, but rather they would be just part of the overall breeding programs, the integrated programs of the CGIAR. And the important thing was to actively advocate for the inclusion of those micronutrients in the target product profiles. And that's the mainstreaming that I think largely has been successful, and that biofortification really is integrated into most breeding programs in the CGIAR around the world. Continued vigilance and advocacy is required, but I think there has been in some ways a shifting of the expense of breeding biofortified crops over to the broader CGIAR systems so that HarvestPlus doesn't have to carry the entire load. So that was mainstream, and I think things have gone in the right direction there. The other aspect is crowding in investment partners. Again, realizing that the HarvestPlus is never going to have a resource to produce and market all the seed itself, but it needs to convince others, governments and private sector partners, to take up the mantle and produce and sell and market these seeds, and then link the output markets to processors and others who can market the products. And this has involved a lot of advocacy work and engagement with seed companies around the world. And I think probably most successful with state seed companies, because in Asia, particularly in India and in Pakistan and Bangladesh, state seed companies continue to have a large market share. And insofar as HarvestPlus has reached out and engaged with them and convinced them and their governments of the benefits of including biofortified crops within their seed production and dissemination systems, they've been able to reach tens of millions of people in places like Pakistan, Bihar, UP, Odisha, and there's some really big success stories there. Again, with this idea of crowding in investment partners, getting others to pay for the production, dissemination of the seeds, and allowing HarvestPlus really to focus more on the evidence generation and advocacy to leverage those dissemination partners' funds. And one other little twist I think that was worked into the last phase of support, really the ongoing phase of support within HarvestPlus, is we asked for our funds to support a hiring of an individual who would focus exclusively on trying to access money from the big international financial institutions, from the World Bank and from the African Development Bank, and for those institutions, Asian Development Bank, that have hundreds of millions of dollars to invest in agriculture and nutrition, and really to have somebody who would actively engage with them and try to encourage them to invest through governments in promoting the dissemination of biofortified seeds and biofortified crops. And I think we have evidence so far that's paying off, and that really tens of millions of dollars are being now accessed through the international financial institutions because of the active advocacy and outreach work of HarvestPlus in promoting this effort to scale the availability of biofortified crops. So things have certainly gone in the right direction, and we look at that hockey stick of a slow, steady rates of uptake of biofortified crops, but then over the last 5 years, really things taken off as the big seed companies, big governments, and international development institutions have really poured more money and resources to make this scaling happen. So we're proud of what HarvestPlus is doing, and we hope it keeps going until it reaches that 1 billion person target.
Great, thank you so much, Lawrence, for that. Was incredibly insightful, and for all three of you talking about your experience. Katrina and Jenny, before you come back in, I'd like to throw out a few questions here that have accumulated in the chat, including one that a couple that I have myself. I think a lot of people are interested in this process of continuous calibration. Or what sort of the fact that it's not a, at least the way you described it, a standard. We develop the seeds, we try to get people to grow the seeds or to multiply the seeds, to grow the seeds, to consume them, but that in fact, at least I understood, that there's a feedback loop, that as you get feedback from food processors, from consumers, from seed producers, you in turn try to get the seed researchers to address that as they develop new varieties or new strains. Can you talk about how that works in practice and maybe some of the things that have worked or not? Because as you know, and many people on this call know, this is something that now is trying to be mainstreamed in other CGIAR approaches to development. And while that's certainly having some traction with the scaling readiness tools that have been developed, traditionally a lot of researchers have not had ongoing feedback with commercial actors or consumers in the CGIAR system in agricultural research. So I guess that one question is, can you talk about a little bit in practice what that, how that process has worked and what lessons there might be for other agricultural research centers in terms of the lessons that HarvestPlus has learned in this continuous calibration. A second question I'd like to put out there to the two of you from the chat is this question of hybrids versus open pollinated varieties, or those that don't have to be, farmers don't have to buy seeds every year. To the extent that you're working with commercial actors, especially in, I think, in areas like beans and legumes, commercial actors don't like to have less interest in some things like beans or open pollinated varieties because they're not as profitable. And how have you been able to get biofortified varieties out there in those areas? A third question that's come up in the chat has been whether or not you use any of the tools that have been developed on the scaling literature, You may be familiar with some of them: scaling readiness, scaling scans, by ExpandNet, though that which have been in the health, scaling profiles, etc., and whether they've been useful to you. And last but not least, well, maybe hopefully we'll have time for more. Are farmers willing to pay a premium, or is there even a premium for seeds that are biofortified? So I know that was a lot, so I'll stop with those 4 questions. But if you could, between the 2 of you, and if you want to respond to anything else that was raised in the chat or in the presentations of your colleagues. Thank you.
Thank you. That was a lot of questions all at once. Where to start? I suppose the feedback loop question, the first question you mentioned, yeah, really important. And I think we can do better with that. And especially when I talked about digitization as well, about how we gather feedback from the users at different stage in terms of all the product attributes, whether it's the taste of the food, the product performance, whether you're making bread with it or custard in Nigeria, those kind of things. Especially when food producers are involved, we have to get their feedback about how it's running in factories, and is it making good recipes. So that part of it goes back down the chain in terms of breeding for different properties of foods. But I do think we can do better there. But I think it does come down as well to that supply and demand thing. And if we're getting that demand from food producers, not only about the nutritional aspects, and we want them to include nutritional markers in their procurement standards, that really sends that feedback quite quickly to breeders and the private sector in seed systems as well, who we want to be part of this. The question on sort of hybrids and seed diffusers and sharing, like Pakistan, for example, it's not hybrid. It's and we encourage seed sharing and dissemination, so there isn't that need to keep repeat purchasing. But farmers do want to buy seeds as well as share seeds and reuse seeds. It's different on a country by country basis and a crop by crop basis, but it definitely is something that we promote in terms of sharing seeds and the diffusion of seeds. In some markets, the price of the seeds is set by the government, so there isn't a price premium on the seeds. In some cases, they might be subsidised and they might be cheaper. In some cases, because the demand is high from consumers and food businesses, they might be more expensive. So it is kind of a case-by-case, crop-by-crop basis. But it's something that we do work very hard to ensure that the seeds are available at a competitive price or freely available in non-commercial systems. And we did talk about non-commercial seed systems, and quite often the seed systems aren't commercial because they are either reuse seeds, shared seeds, paid for seeds, given seeds. The commercialization then happens in the food part. So you propagate non-commercial seed systems through commercialization of the food system. So that's the whole biofortification value chain is so long, and you might not have commercialization and commercial demand in the seed part, but you definitely do in the food part. And whether that's food from the farm gate or whether it's a big global multinational procuring a lot of the grain on a mass basis, but the food system is most definitely commercial, even in public procurement. So whether it's supply chains for school feeding or other international institutional situations, is still a commercial transaction going on that creates demand in the system. Katerina, do you want to answer us the question about the tools from the community of practice and what we've used and how we learn?
Yes, I can comment on that. So we are very much aware of the tools that are produced in the community or are used by the community of practice. And some of them align with what we do. For example, the scaling readiness scan, when you look at where are the bottlenecks in working towards commercialization. So I'll link this with an answer to the other question for an example of how does this feedback loop work when we feedback our lessons learned. And I can only say there's when we assess where to be active or where to intervene, there's no normative truth in what we're doing, because the situation will change. So, for example, in Kenya, we had a project on the commercialization of biofortified crops. During the project, the demand creation in the consumer base was a bottleneck. Now we are working currently on a project where we are addressing this demand creation. The project addresses public procurement models via school feeding, and here again now for this project the bottleneck will be perhaps in the seed production mostly, and so continuously we can describe where currently we are, where, so to say, the current bottlenecks exist and where we need to improve, and this will change over time as well as we move along the value chain. Other tools that we are aware of were also developed very much from a researcher and CG perspective. So we know them, but we don't apply them because they're more on the assessment side of products, like how far are they developed at the end of research, what are potentials, where would this go, what partners can we address, but not necessarily being on the ground, interacting with farmers and the processors and aggregators, collecting this user data. So this goes also into our feedback loops. And we know that, of course, scaling is becoming more and more relevant. So one of the most important issues, I think, discussing scaling with partners in the community of practice is also to match our wordings, to learn from each other, from those different approaches, to address how the terms have developed over time, how the priorities of research institutes have developed over time, and how also the understanding of scaling is continuously developing currently. Yeah, we are also scaling now.
We're sort of out of time, but I think there's an important question here I'd like to raise before we turn it over to Julie Howard to close. And since I'm not going to come back in, well, I will to switch to Julie, but thank all of the speakers and especially the two of you. But Lawrence in his comments mentioned the two principles of mainstreaming and crowding in funding. I understood quite well, you know, in terms of getting a nutritional value and biofortification mainstreamed into the seed development and breeding of various other CGIAR partners. But HarvestPlus does a lot of other things that you've talked about. In fact, Katrina just talked about, like addressing bottlenecks in the value chain, in seed production, advocacy, dissemination, etc. Who's going to do that? Are the other CGIAR centers, have they taken on those roles as well? Or how do you two see that playing out? Or the, yeah. You're muted, Jenny.
The mainstreaming piece is really like critical, and when I say mainstream in this sense, it's mainstreaming nutritional traits into the brief when breeders come together. So nutrition should be as important as yield. So that's what we see as mainstreaming in breeding. Is every product that comes out of the CG in terms of breeding a new crop should have nutrition in there, and that's what we are working hard to try and activate. But there's a lag as we switch from what we've targeted breeding to mainstreaming, and this is something that is of concern. We have to fill that gap in terms of breeding for nutrition for different countries and considerations, but the role of the CG is really important here, and how we work with our partners in the CG about putting that, making nutrition as important as yield.
Maybe you'd like to come in here, Lawrence, since I see you are back with us on the camera. HarvestPlus does a lot of other things besides breeding. You know, they've talked, and you know, I think the approach that Gates has helped encourage of being comprehensive, working with issues of policy, of seed registration, the seed value chain, production, consumption, working with private partners. You alluded to, and they just confirmed that this is being mainstreamed, the biofortification mainstreamed into breeding, but how do you see these other activities ongoing as HarvestPlus, you know, at least you gave the impression, sort of becomes less of an importance in, you know, your portfolio, and who's taking up these other activities?
Good questions, Richard, really key questions. Quickly on the mainstreaming and the breeding, under the reorganization of the CGIAR into the one CGIAR, they now have something called a market intelligence initiative that sets product profiles for all of the crops for which the CGIAR breeds. And there they decide whether it's going to be rust resistance or higher yielding or insect resistance or virus resistance or better processing capabilities or higher nutrition that go into those product profiles. And of course, HarvestPlus and those of us who care a lot about nutrition want to advocate for the nutritional traits to be included in those product profiles, and then the breeders will do their job to try to pursue those product profiles. So it's really important that the HarvestPlus has a seat at the table when those product profiles are being set. And luckily, Wolf, as a member of one CGIAR, and or I'm thinking more about Eric Boy, the nutritionist, has sort of got a toehold there, and he's trying to advocate for that. And that's important that we maintain that, and something we have to pay attention to. But on the flip side, the crowding in investment and dissemination partners, you're absolutely right. That doesn't happen automatically. It requires personnel who can garner the evidence and undertake the advocacy and reach out to the governments, the seed companies, and the international financial institutions. And that's where HarvestPlus has a key role to play. But under the new one CGIAR, HarvestPlus is still sort of struggling to sort of find a space for it to play that role. And I think it has found a new space, but it's working now to try to find funding and support so it can continue to do that advocacy, outreach work to crowd in those dissemination partners. And we're certainly supportive of that and hoping that other donors will jump in and support HarvestPlus as it tries to consolidate its place within the one CGIAR to play that role, but then also spinning off this separate entity called HarvestPlus Solutions as an NGO outside of the one CGIAR that can maybe be even more active in this crowding and dissemination partner space and develop more expertise in that area about how to engage with the private sector and seed companies and food companies. So hopefully that will also garner the funding that it's required to be successful. Richard's muted. Richard, are you muted?
Yes. Thank all three of you and the other speakers. This has been very rich. There has been comments in the chat that they would like to talk to you longer, so I think we may have to invite you back. But Julie, even though we've sort of hit our time, please take the time you need, the next 3 or 4 or 5 minutes. I think we can go over and tell us what you think the lessons learned here are for scaling and mainstreaming scaling into organizations. HarvestPlus has been on a journey for a long time. It's for a while been considered a bit unique, but I think the one CGIAR process, as Lawrence has sort of suggested, is now taking on some of those lessons. What do you see the lessons are, and also the remaining challenges?
Great, thanks. Thanks so much, Richard, and thanks to this panel. This has just been fascinating. I know we're at time, so I just want to make a couple of points. So I come from research space. I ran the research programs in USAID Feed the Future in its early days. And I have been sitting here thinking that a lot of the problems that we faced in thinking about scaling a decade ago, I think HarvestPlus is showing the way forward. And what do I mean by that? I mean, I think, you know, when I was at USAID, we were trying to do a rack up of what are all the research innovations that are out there on the shelf and ready to go to scale. And I remember Howdy at that time, 10 years ago, and continuing, basically saying, we need to have this scaling in mind from the outset, you know, as Jenny was talking about, and have this goal of reaching 1 billion people from the outset. And we were also trying to do that and trying to work backwards, but really didn't have the tools. But I think the main issue at that time and continuing was the excessively supply-driven focus of agricultural research, right? Sort of the attitude, you know, which worked, I think, pretty well during the Green Revolution, you know, that if the innovation is good enough, you know, the rest of the parts of the food system will pay attention and fall in line and stuff will get out there. That's actually not true. So I think what HarvestPlus has shown through its experience and through the partners' experience is you really have to work at busting down this supply-driven mentality and way of operating. It is nothing that's going to come naturally. So just a few things that I noted during the conversation. This pivot, you know, very, very important. The pivot in the last 4 or 5 years in HarvestPlus from proof of concept, from focus on breeding, from advocacy, to much more direct focus on what has to happen in the rest of the food system for these things to go to scale exponentially. So some of the things that other people have mentioned here are this sort of continuous calibration. I really like that. I think that's, Richard, I predict this is going to become a meme for the scaling community of practice. I really appreciated also Lawrence's insights, because I'm seeing this in some of the other scaling work also, the critical role of funders like Gates and also USAID in working with research organizations to say, you know, you can't just focus on breeding, you must focus on the downstream parts and bring them into the conversation very early. There's that aspect, and there's also sort of the, you can't do all of these things yourself. You can't do all the demonstrations. You can't do all the proof of concept. You can't do X, Y, Z. You must rely more and more on partners. And we saw, you know, with the Cato Foods, you know, how they're taking that mission forward. We saw with World Vision, you know, how they're taking that part of the mission forward in NGO space. So I think Richard probably let me stop there, but I, you know, just am sort of struck. I also wanted to say Atanuki made a very important point for the private sector in thinking about mainstreaming and going to exponential growth. Changing consumer preferences is so difficult, and the importance, the power really of starting with foods that people already eat is very critical, very important, especially for innovations like HarvestPlus focuses on things that are invisible, things that are not really even marketable by farmers. So start with foods that people already eat. Okay, let me stop there, but this has just been fascinating. I have learned so much, and it's exciting to think that the world of scaling has changed so much in the past decade. And Richard, we have a big job in documenting this in the months ahead. Thank you.
Yes, well, I guess I will have one last word. As I mentioned at the beginning, the Scaling Community of Practice has a new initiative on mainstreaming, and we're going to be writing up case studies of these experiences. We are very excited to announce that both that Jenny and Katrina and HarvestPlus have agreed to write up a case study of what the experience has been of scaling and how to integrate scaling into their work. I think we should have these cases sometime this fall, September, October, certainly by the end of the year. You know how these things go, so please stay tuned. And we will also be having more mainstreaming webinars in the fall. So this will be the last one for the summer, but thank all of our speakers and for all of you who joined online and for the excellent questions in the chat. If you don't feel like you got your question answered, I'm sure that Jenny and Katrina would be glad to answer them, and or the other speakers. And I wish all of you a great day. Thank you so much.